Okay, let's get started. Hello, everyone, and welcome to the AlzInColor Brain Health and Alzheimer's Community Webinar Series. Thank you for taking the time to join us for this first webinar in this next phase of our monthly six-part series. We're excited to create a space for meaningful conversations, education, storytelling, and community connection around brain health and Alzheimer's disease. Before we begin, let's go over a few quick reminders and ways we can engage with us tonight. First, this session is being recorded for future educational use, and please submit your questions using the Zoom Q&A feature for the Q&A session that'll be later on in the webinar. And speaking of engagement, your voice and feedback are important to us. We encourage you to scan the QR code and complete the brief post-webinar survey at the end of tonight's session. Your feedback matters and helps us improve future webinars and continues providing meaningful, culturally relevant resources for our communities. So let's begin. With that, it's important to first touch on why conversations like this are so important. Alzheimer's disease is a growing public health crisis. By 2030, it's projected that nearly 40% of individuals living with Alzheimer's will be Black or Latino. Black Americans are twice as likely to develop Alzheimer's disease compared to white Americans, and Latinos are 1.5% more likely to develop Alzheimer's disease as well. Yet many of our communities still face barriers to early detection and diagnosis, access to care and resources, and education centered around clinical trials and innovative treatments. But knowledge and awareness is important first steps. For example, did you know that amyloid buildup in the brain, which can cause memory and thinking issues over time, can start up to 20 years before symptoms of Alzheimer's disease appear? I'll let that sink in for a second for you. This is highlighting the importance of why regular brain health monitoring is important and why having those early conversations are important. Also, up to 45% of dementia cases, including Alzheimer's, may be reduced or delayed by addressing modifiable risk factors. And that's many that are linked to daily habits, lifestyles, and overall health choices, which can include things such as nutrition, sleep, and exercise. That's why representation, education, and trusted community conversations matter. And sometimes addressing these challenges begins with simply being willing to face them. I love this quote from James Baldwin that says, "Not everything that is faced can be changed, but nothing can be changed until it is faced." In our communities, we sometimes wait for someone else to create the solutions, but sometimes we must be the ones to step up and make impactful change happen. That spirit is what has helped inspire AlzInColor. AlzInColor is an authentic, culturally resonant campaign rooted in lived experiences. Our mission is to elevate brain health conversations across Black and Latino communities through education, storytelling, advocacy, and trusted resources. We center Black and Latino faces, voices, and stories, shifting the narrative from silence to storytelling, from invisibility to visibility, and from fear to empowerment. Our goal is for individuals and families to feel seen, heard, and supported. And one of the biggest things we've heard from community is the need for accessible resources. Through conversations with our community advisory board members and previous webinar participants such as yourself, we listened and learned about the challenges faced when trying to find trustworthy information and support. That led to the creation of the AlzInColor Digital Community Resource Center, which we are excited to share launched this past January. It is a culturally relevant hub connecting communities to education, support services, caregiving tools, as well as policy and advocacy resources. At the heart of this work is our mantra of raise the volume, using storytelling, art, and culture to normalize conversations and encourage people to seek support and take action. Because we know representation has the power to change how communities respond to brain health and Alzheimer's disease. By centering Black and Latino communities through our website, webinars, storytelling, and partnerships, the goal is to help communities first normalize conversations, which is so important. This means we want to encourage open and early dialogues. We want to reduce stigma by bringing Black and Latino faces to the forefront. We want to provide culturally relevant information, emphasize why incorporating healthy daily habits into your lifestyle is important, and encourage involvement in research such as clinical trials. Representation matters and helps to spark earlier conversations, encourage families to seek help sooner, strengthen community support systems, and empower people with knowledge and tools. And we'd like to explore some of the ways we're bringing this vision to life. The AlzInColor website includes several ways to learn, engage, and connect. You can explore the educational resources and support tools in English as well as Spanish, such as general and state-by-state resources. We have a news and education section that includes articles and personal stories. We have educational blogs and also includes our previously recorded webinars. You can also take the brain health quiz, which helps start the conversation. To help raise the volume, you can share your story around brain health and Alzheimer's, which can be done through uploading your story to our website through your desired creative expression, which it simply can include sharing your story or through song or even through poem. And you can also view other stories as well. And as mentioned, you can visit our blog section where, for example, we have the Kickstarting a Brain Health Conversation with Your Healthcare Provider, which supports early brain health conversations with a doctor, nurse practitioner, or even physician's assistant, and includes a downloadable family history brain health questionnaire to support those early conversations. And behind this campaign is a dedicated team working to help move this mission forward. I'd like to introduce the AlzInColor team, Dina Darlington, myself, Kathryn Boxill, and Ramses Parada. And we have various other dedicated partners that support this work. An especially important part of this work is our AlzInColor Community Advisory Board. We're excited to have expanded our CAB membership with returning and new members to broaden our reach and deepen community engagement across the country. Our CAB members include leaders from faith communities, advocacy organizations, civic organizations, as well as community-based organizations. They are the lifeline of this campaign and helping us engage communities through churches, civic groups, health fairs, salons, barbershops, and other trusted spaces. We have representation across the U.S., such as Georgia, the D.C. area, California, and Kentucky, which helps us continue expanding our impact nationally. And I'd like for our CAB member, Pastor Owens, to share about why these type of campaigns are important for supporting community. Welcome, Pastor Owens.
Thank you, Kathryn. And on behalf of the board, thank you for your leadership with all of the strategic work that you do. And thank you, Dina, for your vision to help see this baby come alive. I'm excited to be a part of this board, nearly 14 members on this board, as she said, from DC all the way to California. We have been settled with the awesome responsibility to raise the volume on awareness and advocacy. We feel very strongly that our people perish for lack of knowledge, and you cannot lead where you don't go, and you can't teach what you don't know. So we have the awesome, exciting responsibility to be sure that we get the word out so that when we have awesome speakers like Dr. Easter and Dr. Rochester coming, the information can get to our people. So we're excited as a board to be a part of making that happen across the nation. Thank you, ma'am.
Thanks so much, Pastor Owens. We appreciate it. And now I'd like to introduce tonight's incredible guest speakers. First up is Dr. Bashir Easter, who is the founder and CEO of Melanin Minded and Melanin Minded Foundation, and he is an AlzInColor Community Advisory Board member. Through the journey of caregiving for his mother, who had Alzheimer's, Dr. Easter has since dedicated his work to focusing on dementia awareness, youth caregivers, and creating dementia-friendly communities for people of color, especially through his newly launched Navigator Transportation Program. His research and advocacy continue helping shine a light on the unique experiences families face in our communities. Next up is Dr. Nicole Rochester, who is a pediatrician, healthcare advocate, TEDx speaker, and founder of Your GPS Doc. After navigating the healthcare system while caring for her father, she became passionate about helping patients and caregivers better communicate with healthcare providers and advocate for quality care. Her work centers on health equity, caregiver support, and bridging gaps in healthcare access. Dr. Easter and Dr. Rochester, thank you both for joining us. We're excited for this conversation and the insights you'll share with us today. So now I'll come off. All right, so thank you. First question is, of course, can you both each share what led you into this work and why brain health and caregiving advocacy became so important to you? And we'll start with Dr. Rochester, because ladies are first, right?
Well, thank you, Kathryn, and to the Community Advisory Board and AlzInColor and all of the attendees and everyone involved. I'm grateful to be here. Thank you for having me. So, as you mentioned, I'm a pediatrician, and so people may be like, "Why is a pediatrician on a webinar talking about Alzheimer's and brain health?" And it's really all because of my late father. And I was part of the sandwich generation. I know we're going to talk about that a little bit later, but in my early 40s, my late father, who had a lot of chronic health conditions, everything just kind of started to worsen and deteriorate at a pace that was more rapid than previously. And while he did not have Alzheimer's, he did have vascular dementia amongst a host of other chronic medical conditions. And my sisters and I found ourselves having to rather abruptly step in and care for him. We didn't call ourselves caregivers at the time, we were just being daughters. In fact, I didn't really identify as a caregiver until that journey had ended. But we respectively kind of figured out what our lanes were, based on our own professional knowledge and expertise. And so while all of us did a little bit of everything, with me being the physician in the family, a lot of his medical care and overseeing that care became my responsibility. And so I left this world of rainbows and blowing bubbles and playing with patients on the floor and all of these things into this world of adult medicine and going to doctor's appointments with my dad and He was in and out of the hospital, lots of emergency department visits, assisted living transition, and nursing homes, rehab facilities. And it was mind-blowing, even as a physician, to experience the that full spectrum of medical care. And there were so many things that were disheartening, not the least of which were the invisibility that I felt as his daughter, as his caregiver, the invisibility that he felt as a patient, the lack of coordination, disjointed communication, and just a lack of empathy. And so I was privileged to be at his bedside and to just be involved to the extent that I could pick up mistakes or gaps. And I was just, kind of asking questions and pushing back respectfully and doing things that most caregivers, everyone who's been a caregiver can relate to. But I had that added benefit of being a physician, and I didn't appreciate it fully at first until I had to flex my doctor muscles, I'll say, because the care at one point was just really abysmal. And I spoke up in one encounter and said that I was a physician, and I literally almost instantaneously saw his care transform because now I was viewed as an insider, as a colleague, and not just as a daughter, a caregiver. And that moment has never left me. And so once he passed away, I just started reflecting on the ways that that was a privilege for our family, for me and for him, and the ways that most people don't happen to have a daughter who's a physician or a nurse or a healthcare professional. And so, as you stated, my company, Your GPS Doc, was founded almost 9 years ago now to really be that bridge between the medical community and patients and caregivers, and to help them navigate the healthcare system and to help them understand their medical conditions and to better communicate with their healthcare providers.
Awesome. Thank you so much for sharing that. Dr. Easter?
Yes, we're talking family tonight, right? We're all family.
We are.
I don't have to do too much of the conversation because Dr. Rochester just stated what we all have gone through. The difference of that is that she had the medical background. Mine, we did not. And so when my mother was diagnosed with just dementia at the age of 55, I think some people know my story. We didn't go to the doctor because of having dementia diagnosis or any dementia symptoms. We were going to the doctor because she wasn't managing her diabetes. And so as we walked through the journey of the doctor giving us the diagnosis, he did not explain resources, services, and supports. And so we're looking at each other and still trying to understand what pill did she need to take to get better. And he didn't take the time to explain to us exactly what we needed to do to provide the right care. We didn't know what to advocate for. We didn't know what to say. All we knew is that we had to take care of our mother. And so as we were taking care of her, we were doing it all wrong. And so as we talk more tonight and having more discussions is more of what did we need to know. And then also understanding very clear it's 2026 and we are too far behind. Mm-hmm. So webinars and conversations and information that we will receive even today will be helping push people forward because there's a lot of information a lot of people still don't know and should know. And so I'm happy to be a part of this and share more as we go forward.
Absolutely. Thank you. Thank you for sharing that. And so, you both were talking about your personal journeys and experiences. And based on that, how did that change the way you view the healthcare, the support in the system, and based on the needs of your families and navigating, whether it was Alzheimer's or chronic conditions?
So the beginning of that story, as I shared a little bit, is everything fell in our lap. So there was no education early in life, children or families, even though we had people in our family were showing different signs of different types of dementia. We've never discussed it. We use certain terms. I say now we call it old timers and senile and certain terms of touched, right? But not really. Don't go in the room. Uncle Jerry's in the room. Don't say nothing to him, right? So we were involved in these type of medical situations in our families and never had someone explain really what was going on. And so generation after generation after generation led to us having misunderstanding, no diagnosis, and nowhere to turn to actually find out about help and services. Other thing I had as well is until I started working for the Department on Aging, and that was just because I was looking for a job, is when I started realizing that there were these resources and these services that were right in the heart of my community at the Aging Disability Resource Center that I could have gone down. And I realized as I started working there, as I said, I'm talking to family. When I started working there, I started realizing where the services were being given and who was taking the resources. And it wasn't us. And so not like the information wasn't there, but it was also thought, well, that's not for us. That's an older person, white person's disease. That's not something that goes in our community. And so it continued on to generations and generations and families believing that. And then it put us further and further behind. And so when we talk about bridging the gap, as Dr. Rochester said, the medical community did not feel that they need to explain or certain amount they needed to explain, or they felt as in certain capacity, we can't cure. So what do we do to provide this information to a community? And it was very needed. All we needed was the information. If we had more information, we could have done better with the quality of life for my mother to live.
Yeah, absolutely. Thank you. Dr.
Yeah,
Rochester?
I completely agree. I love the different perspectives that Dr. Easter and I bring, but also the similarities. And so, being a physician, my experience with my dad was very interesting because I was like an insider and an outsider at the same time. And as frustrated and as angry as I was often with the experiences that we were having and with my colleagues, I also understood what was going on behind the scenes. You know, when they had that annoyed look on their face when I was asking that question just before they put their hand on the doorknob to leave, I understood because I know that they had, 2, 4, 10 patients waiting for them, or that maybe they were running late. So I was always kind of straddling this fence of advocating first and foremost for my dad, and also understanding as a physician, what these healthcare providers were facing. And to Dr. Easter's point, the system itself is just completely broken. And not to let my colleagues off of the hook, but most people who are doing this work really are doing it for the right reasons. And what I have discovered through the work that I do now is that really good healthcare professionals just aren't being given the opportunities to show up the way that they would like to. And so there are major gaps, as Dr. Easter mentioned. And frankly, some physicians aren't even aware of some of the resources, like there's a focus on the medical conditions and the treatment. And in that 10 to 15 minutes, they're getting that. And now people are being held accountable to outcomes. And so boxes are being checked, just to be very transparent. And then on the other end of it, not every healthcare office, doctor's office has access to a case manager or a social worker or somebody who could pick up the ball and then continue these conversations. And so there are lots of gaps. And also, as Dr. Easter mentioned, the disparities exist in some part because of this lack of access to resources and care. And a lot of times we're being diagnosed much later. And so, the resources and the education are important. And from my standpoint, it's letting patients and families know the questions that they should be asking, letting them know that there are options, and even being able to recognize, am I getting good care? Because if you don't know, you don't even know that you're not getting appropriate care. You don't know that there are other options. So that's why webinars like this are so important.
Yeah, and you know what, let's stay on this topic in terms of speaking of healthcare, the health system, and talking about pushback and everything. When sometimes, we talk about self-advocacy, right? But everyone doesn't, or how to advocate for family members. And everyone doesn't know how to do that, right? Or haven't been in enough situations to know how to do that, or they hold doctors to a particular standard. So, they feel like they can't do that. And so with that, sometimes, they're hesitant to ask questions or to push back during appointments. What would you say to somebody who feels intimidated or dismissed during their healthcare settings or sessions?
Find a new doctor.
Ooh, he
Plain
took
and
my
simple.
answer.
So I believe that this is a team, and this is what we saw about advocating. Um, One of the things I had to understand is, as the doctor said, what's the two sides? But there's two sides to that, right? You have the medical professionals go, oh, right, to be able to do good, right, to be able to make sure that they're providing the right services. And I believe that is wholeheartedly what they want to do, very clear. But something is missed when it comes down to understanding community. Community is living life with any type of ailment and not understanding what it takes to be the doctor to pay those bills. So what we start having conversations about is when a doctor or physician makes a diagnosis, they have to be paid for that. So there's a code that's associated with that for billing. So when we talk about giving just a dementia diagnosis, that's a catch-all, a code to be paid. When I usually say to individuals, if somebody says the loved one has dementia or someone is diagnosed with dementia, I then say advocate and ask what type. In order to get the type, which we all need as caregivers and all the family need to know to provide the right care, that person or doctor needs to do a referral. So then that referral goes to someone who is a specialist to what? Get paid under another code. We look at it as they gave us a diagnosis, this should be it. No. And they're not recognizing that the family are now had to provide the information and anything that was given and provide everything moving forward in the home. The families also need to understand is we have to teach what are the right words and things to be said. And I think truly that should come from the medical community. What are the certain terms, lingo, words that they need to say in order for things to move forward? I'll share one more thing real quick with that. My mother was in the process of actively dying. This is when she started getting to the later stage. Her brain stopped telling her to swallow. And so she started to aspirate. My sister called me and she says, they said mama's about to die. So as doctor says, I'm running up there because I need to talk to the doctors because I need to know what they're saying. As I get to the doctor, the hospital, we're having conversation and dialogue. And I said, who told you that she was dying? And did they say she was actively dying? Because I know the words. The doctor hears me say this and is too worried about who I was. Am I a doctor? How do I know this terminology? Instead of just explaining to me, can you tell me, is this in her medical chart that she's actively dying? And he thought I was challenging him, and I was not. The reason why I needed to know if he was putting this in her chart that she was actively dying is because we needed to start preparing for hospice. As a family, we needed to know the terms to then activate what needed to happen to provide the right care for her to get home. And so those challenges and that dialogue is important for our community to know the words, the comments, the statements, to then to do the right thing to provide the right care. And the medical community needs to understand that just because doctors talk to doctors, physicians talk to physicians, that don't mean they talk to community. And so those things that we need to work on in a bridging of communication and language to do the better care for the individuals that we're loving.
Absolutely. Absolutely, Dr. Easter. I'd laughed and said he stole my answer because I agree, to go back to what do you do? As a physician, I am a fan of firing physicians when necessary. And sometimes it is necessary. Other times you may be able to repair, communication gaps and things of that nature. The other thing I'll share is that there are sometimes things that we can do. And I'm not saying that that you all should have to do these things, but sometimes there are ways that you can push back that in a way that is not only respectful, but also somewhat disarming. So just to give a couple of examples, Dr. Rochester, I know you're really busy. Like you look really busy today, and I know you have other patients, but there's something that I am really concerned about with regard to my mom, my dad, my spouse. And if you could just give us 5 more minutes and often by just acknowledging, like, I know you're really busy, or I know you look really stressed out today, that in and of itself can just make the doctor just you know, because then they feel seen. And so it's not like trickery or, it's just connecting human to human. And then the other thing is, always using words like I am concerned, I don't understand, help me understand. I think those are buzzwords that for most doctors should at least slow them down a little bit and have them sit down and spend a little bit more time. And if not, if you just have a doctor who is consistently not connecting, not available, dismissive, then yeah, I'm always recommending that you find someone else. And I know that that's easier said than done for many reasons. Sometimes based on your insurance, there may not be a lot of other physicians, especially specialists based on your geography. There may be some challenges with finding other specialists, but if at all possible, when you are not being treated properly, when your loved one's not being treated properly, you know, take action in finding another provider.
Yeah, those are really good tips there in terms of one understanding, terminology, right? Actively dying, you don't want to have to use that, but just for those examples or to disarm, right? And say words like I'm concerned in order to have those conversations, take place a little bit more. And so with that, in terms of what are there any other words or tips you can share with people centered around their visits that can help them navigate that um, with more ease?
Yeah, I can start. Asking questions is incredibly important. And as you stated, Kathryn, it's something that a lot of people don't want to do, either because they put the physician or the healthcare provider in such high regard, or they feel, well, this is going to make me sound stupid or look stupid, or I should know this. But asking questions is really your greatest tool in examination rooms, hospital rooms, emergency departments, because sometimes your question not only will slow the healthcare provider down, but it can make them entertain a diagnosis that maybe they weren't thinking about. Medical training, especially now, is very algorithmic, particularly with electronic health records and those check boxes and things I talked about earlier. And so a lot of medicine is around pattern recognition, and that's necessary because we can't memorize, every single thing. But not every patient reads the textbook, as my medical school professor used to tell us. And sometimes patients and caregivers are the ones that suggest something to just kind of make the healthcare provider expand their mindset. And that's happened to me, as a pediatrician, where a parent has said, "Hey, Dr. Rochester, have you considered this?" And so asking questions is important, not only asking questions about things you don't understand, but, again, if there's a concern that you have, always ask it, always address it. Your gut reaction, your gut feeling is probably accurate. And with my dad, there were so many times where my sisters and I recognized early signs that things were going downhill before his lab results showed it, before an X-ray or a CT scan would have shown anything. And so I have learned, again, as a pediatrician, I always trust parents. And I think in general, we should always trust patients, always trust caregivers. That person way better than a doctor or a nurse who spent 10, 15 minutes with them. The other thing is to really own this idea that you are the expert. If you're the patient, you may not have gone to medical school, but you're the expert for your own body. You're the expert for the changes that are happening. And as it relates to dementia, the caregiver is often, or the expert. And I think that one of the things that I would love to see is for caregivers to really own that, not in a way that is arrogant, but just in a way that really positions yourself as one of the experts on that team and as someone who has intimate knowledge of your family member and awareness of subtle changes in their behavior and in their personality. Dr. Easter talked about his mom not managing her diabetes. With my dad, who also had diabetes, he was an electronics like fanatic and had all kinds of things, different, DVD, VHS, all the things. And he got to the point where he couldn't figure out how to turn his TV on and off.
Mm.
And that was a sign to my family, like, wait a minute, this is the guy that buys the new gadget as soon as it comes out. And he's calling me to tell me that he can't turn his TV on or he can't figure out how to, get the DVD to play. So caregivers are experts. And I think it's important that you position yourself as such.
And I'll
Awesome.
just add to that
Mhm.
piece. First is make sure that you have your power of attorney documents and your documents in order. And so if that individual is going to be speaking on behalf of that loved one, please get it done before they're unable to get those documents completed. Because that's what you want to make sure there's no barriers, because that has happened, that you'll get to the doctor and they'll say, well, who is the person that's speaking for this individual? And I've seen it to points where they will actually continue to speak to your loved one, and that will shut down more of the conversation because they'll say there's no problem, there are issues. Knowing as you as a caregiver has a plethora of things that are going on that you need answered. So make sure your documents are in order, and those are easy to get done, right, in certain capacity. Another thing is, once you get those items done, the goal is to get some of those questions answered. Try to set up an appointment before you actually meet with your loved one with that doctor. If you can get there an hour earlier, or even talk to them on the phone, or create that relationship where you're able to have that dialogue with them freely about what's happening, that would help the visit even more. Very, very clear to understanding that sometimes when they do get in, they have to understand that when they're talking to your loved one, it could be very derogatory kind of way. They're talking down to them, or they're speaking to them like they're a child, or asking them questions that they can't even answer. And you, but early as the caregiver, as Dr. Rochester said, you've gone through the weeks, the days, and all this time to see exactly how your loved one is starting to progress, how they can be presented so the information can be more pleasant when you make it there. The other thing is that I think we should all do, but even in this case, ask for those records. You want to see what has been written in those notes. There was a study that was done that you talk about different discrimination. There were certain notes in certain doctors, talk to doctors, and the first thing they look at is the notes for what the previous doctor said. And some of the information in there could be non-compliant. It could be something aggressive or something that is stated that could say from that person to read those notes to then have a misjudgment of that person when they walk into the room or conversation. And so make sure these things are said and done so you're prepared to be able to get as much help and information for your loved one as possible. And I know a lot of things are not talked about, but these are things we've noticed over time that can be able to hinder this service and this care to be sped up instead of being blocked.
And can I add one more quick thing, Kathryn?
Yeah,
This is
sure.
so good. I just want to also just briefly mention the patient portal, because as Dr. Easter was talking about these conversations, it would be amazing if you could spend 30 minutes or an hour with your doctor before the appointment. And in many cases, that's probably not going to be feasible. But a lot of patients and clients that I work with in health advocacy, they're not maximizing the use of the patient portal. And so recognizing that in between visits, you have access to this tool where you can send a message to your loved one's provider to say, hey, this is going on. I'm concerned about that. Or, hey, I know we don't have an appointment for another 2 months, but this is happening. So those are ways where you can really have that asynchronous communication, but you can get questions answered, you can get concerns addressed in between those doctor visits. You don't have to wait until the next appointment to communicate with your doctor.
Thank you so much. So that was great. And so I want to shift the focus kind of back to talking about family, right? And how that you navigate within the family unit. And so, Dr. Rochester mentioned the sandwich generation earlier. And so, we've been hearing that term more often, the sandwich generation. Can you talk about the realities of aging parents who, while also supporting children, careers, as well as households?
Go ahead, doctor. Start
Okay,
off.
I'll start. Yeah, so it's hard. It was very, very difficult. For me, I was at a stage in my career where, I was kind of right, going up the proverbial corporate ladder, healthcare ladder, for lack of a better word. And so there were a lot of demands on me, and I was, really enjoying my career and starting to think about next steps at the same time. When my dad first got sick, I think I have two daughters who are now young adults, but at the time they were 10 and 15 and, active in extracurricular activities. And of course, school was demanding. I was married at the time, active in my sorority, active in my church. And so figuring out how to juggle all of those things was very difficult. Particularly, I would say, kids and like home, a family at home, and then my dad. and having to have conversations with my kids and with my then husband about these responsibilities that I had with my dad, and making sure that my daughters understood that, there may be some times when I can't be at some of the events. Luckily, that didn't happen often, but just making sure that everybody understood that my time was going to be divided, and figuring out how to juggle those things. There were certain things I had to stop doing, things that I had to let go of, tasks and responsibilities that I had to put down. And then the other thing I'll add is, interestingly, as a physician, and this has to do more with career, I did not initially disclose to the fellow doctors in my healthcare, my medical group, about what was going on. And I was the medical director, so I was like the boss, so to speak. And to this day, I'm still kind of asking myself, like, Nicole, why didn't you do that? But for months, I was just trying to juggle everything. And, if I had to take a call, I would kind of, go around the corner and take the call because I shared the office with another physician. And then finally, one day in a meeting, I just broke down in tears, and I was, explaining to them what was going on. And of course, they all ran to my rescue and like, oh my gosh, I wish we had known. And what can we take off of your plate? So I guess the other tip I would say, is to just ask for help. Those of us who are high achievers, we often are not good at asking for help. And that's one of the big mistakes that I made as a caregiver while juggling all of these other things.
Absolutely. Absolutely. Dr. Bashir.
Yeah, so I want everybody to pay attention to what the doctor said. She had the height of her profession, education, family, and couldn't talk to anybody. Was putting it all on her shoulders to try to figure it out. And we are all recognizing and thinking, again, there's nobody going through it just like we are. We all do the same exact thing. So I want people to understand, when you are a caregiver, we are caregivers. And a lot of times we put ourselves at the bottom every time. We don't reach out for resources, services, and we talk about caregiving individuals who may have certain other ailments, but we call it normal aging. But with this disease, it will tear a family apart. And we have to understand and recognize that very clear, especially in our community. We got to stop it. Our culture and denial is killing us because we don't recognize it. We take on this mantle, or this armor, or putting on this bearing a cross, and not recognizing that we're supposed to help each other. And those are the other components that comes along with it. The doctor said, she finally said it to her peers. We won't talk to our family. We won't have a conversation with our neighbor. We want to hide it. We want to mask it because we don't want nobody in our house. We don't want nobody to know our business. And that's cultural. And not recognizing that is not something we should do regarding this. We need all the help we can get. Call every Army, Navy, call everybody that you know to come and help support. And as a caregiver, understanding very clear, as we tell the story, it will wear you out. And we have to tell that story. We have to understand very clear. We are burning the candle on both ends. We're not providing care out of love anymore. We're providing care out of strife, struggle. We're burnt out. We're stressed, and we don't share that either. And then what is the stats? This was it 37 to 47% individuals caring for a loved one will die before the individual that is impacted and living with the disease. There was a statement I heard more recently. Once the person is diagnosed, one of the family members or all the family is diagnosed. Because now they have other medical issues that they're not caring for that's not going to be exacerbated. Yeah. So you're absolutely right. It's fell in our lap. So any support information, anything that we need to get it. And we need to get it quickly. And that also is that support that is needed from family and friends. And we know very clear that some families say, I'm not doing it, or I can't. That's the denial piece. We got to learn how to work through that as a community to be able to make that happen. So I'll add that piece as well.
Yeah. And Dr. Easter, you just said, you mentioned, call on the Army, right? And family support. And I know, with your family, that included the children, the youth in the family, which they call the invisible caregiver.
Invisible caregiver.
And so, based on your work, which highlights your experiences working with youth caregivers in the communities, Can you speak to about why this issue deserves more attention and what families should recognize? Because, we talk about caregivers or, at the point where you call yourself a caregiver, right? Because Dr. Rochester said it, she wasn't even calling herself a caregiver, right? But that expands beyond just the adults, right? It's the youth. And so can you share about that and what that means?
Yeah, so I just published, me, myself, and Dr. Farron Epps just published the African American Adolescent Experience, Providing Care for Family Members with Dementia. And one of the things that got me that was to watch my family providing care. So my sisters provided care, but she wouldn't let nobody in the home. So my nieces and my nephews were providing the care in that home. For whatever reason, it was like everyone has to pick up a pail and provide help, right? And so my older nephew, as he was providing care, he leaned in, picked my mom up, he changed her, he gave her food, you name it. My middle nephew, he rejected it most of the time. He said, I don't want to do this. They were teenagers. And so she went, you better do it. This your grandma, and so he did. But my niece, she was 9 and she was giving my mother insulin injections at the age of 9. Wow. And so when we were watching her, and my sister taught her to do this. And so what was interesting as I watched her do that, do you understand what it takes to give somebody an insulin injection? We're not talking about the pen that you can push now. That is literally testing them with the prick of the finger. You had to also take it and put it on there, read it, know what number it was, draw with a little bitty with syringe and then the bottle, how much insulin was needed. She knew how to pinch my mother's stomach to then give her the injection that was needed and then band-aid her finger. And if there was any issues in any blood, she had gloves on. This is 9 years old. So there's a lot of homes doing that. We're teaching our children CNA work, personal care work. They're getting all of these different type of medical treatments and training, but we're not recognizing them as such. So that intrigued me. And I wanted to know how many more people were out there like that. So I started doing it for my research, and I found out wasn't nobody talking about African Americans and Latino youth providing care in the US. All of the care of youth was in the UK. They were called carers. And so, very uniquely, I had to find what the research was. And I kept coming to get it that was really overseas. But I was watching it very clear. And I'll use one quick example of that. As I was going through my research, one of the teachers that I was in the class says, no youth are providing care like that. And I'm listening to her, and I'm like, yeah, they are, because I'm watching them. But she didn't believe it. So when we talk about our youth, we are having them provide food, sitting with the loved one. They are reading to them. They're having conversations with their grandmother, grandfather, and uncle, and they're not remembering their name. They're having outbursts. And the adults have no clue about the type of dementia they have. So how do you think the youth are? So we were focusing on recognizing their internal and external experiences and realizing, as Doctor said, she wasn't a caregiver, so the youth didn't call themselves caregivers. They were just sitting with the grandma. So we had to educate the youth to understand very clear what it looks like to care for a loved one and then allow them to have a voice. And some of their voices were they were depressed. They were missing school. They were having issues with peer interaction. But then they had resiliency came out of it as well. So we acknowledged them, we provided information and training, and then we paid them. We do it to this day. We have them connected to workforce development, so they're paid through the things that they're doing as they're helping their families and part of it. And they were recognized at the Alter Summit that now there's a full council, a group of youth that are explaining their ability to be caregivers and what they need. And so that's talking about working with us as a whole, the family as a whole unit being recognized and supporting that care. But it is very important that we talk about educating up. We start with everyone in that household that needs to know exactly what it is and what it isn't, and then be able to support them financially, and then actually supporting them to be able to let everybody else know what they're doing as well.
Awesome. Thank you so much. We have a question. Well, we have a comment in the Q&A from Rhonda Wells. She says, thank you both for being so informative. This is great information. My mother lost her ALS battle 3 years ago. Sorry to hear that, Rhonda. And I would like to comment on hospice care. You don't have to wait until your loved one is near death to access hospice resources. My mother was on hospice 2 times for 6 months each time. It was a tremendous help to me as her caregiver. Thank you for sharing that point, Rhonda. And then Rhonda also asked, how can we break these barriers to ensure that caregivers of color understand how to reach out to these resources?
I think this is a start. I think that the resources, the program, the paper that Dr. Easter just mentioned, I think that those of you who are watching, if you really want to help, share this recording, let people know, because the reality is there is a lot of really good work being done inside of our community and outside. But the problem is the work is often siloed. And so this organization is doing work, and this organization is doing work, and this organization is doing work, but there's not coordination. And that's what I love about AlzInColor. You all are providing on one site that links to other resources, to other organizations. And so I think that this work is so important. And I think that all of us, those of us who are panelists, the community advisory board, those who are watching, we have an obligation to share this information and to share the resources. I also think, and again, I know organizations are working with this, including Fayron Epps, but involving our religious community, I think, is incredibly important. Involving our sororities and fraternities, historically Black colleges and universities, like the places where we gather already, barbershops, hair salons, again, all of these organizations I think are represented in some part this evening, but making sure that these conversations are not siloed to caregiver conferences, but we need to be talking about this in the general community.
Also
Absolutely.
adding on to
Mhm.
palliative care is what was added. So palliative care is way as before we talk about hospice. And those are funds that are 100% covered regarding your loved one. That's a whole team, a whole group that's there to make decisions and to help you with the care for your loved one. And it is used in a certain terms that have been, and I don't know where it started, but it is a thought and a process, whether it was some truth involved with it or not, but it's spread across generations. That if your loved one is on there, they're going to kill your loved one. They're going to and that you already speaking into existence. No, these resources, I guarantee you, there's a whole other group that's getting them.
Yep.
I guarantee you they're getting
Absolutely.
these resources right now, and we're not, and we're
Yeah.
missing out, right? And so that's you're right, and so that's the other thing. And the way that we continue to have these conversations, number one, dispel myths, bring some truth and real resources immediately. Not just talking about it, be these connectors. I'll tell you another program that just started, maybe 2, 3 years. And each time I ask, how many of the community know about it? It's called the guide model. If you don't know about the guide model in your community or in your region, you need to spread it and ask who has the information about it. Because these are these connected services that are for individuals once they're diagnosed that follow them through the continuum of care. And these resources are being used, but when it comes down to our community, we're the last to hear about them. And they're right there for available to use right now.
Okay, we got one last question before we close. Here, this is anonymous. I appreciate your personal stories and experiences with family members. What are signs that are not always obvious that you or a loved one may need support or care? What surprised you about your experience?
Go ahead, Doc.
So what surprised you? And the first part was what are signs? Can
What
you
are
repeat the first
signs
part?
that are not always obvious that you or a loved one may need support or care?
Well, I mean, signs that are not always obvious that you may need support. I'll speak from a caregiver's perspective. We often think about mental health, mental illness in terms of extremes, but not sleeping well. Like depression isn't just tears. I mean, I mentioned my kind of breakdown in a meeting, but being overly sad, yes, we all know that's a sign of depression, but not sleeping well, not eating well, losing interest in activities, not because you're so busy as a caregiver, but you just don't even have the desire to participate in the activities that you used to want to participate in. Those are some of the signs. being overly emotional in terms of kind of being anxious or snapping at your children, snapping at your family, just things that are different from your normal personality, that's probably a sign that you have too much on your plate and that you need to ask for help.
Yeah, that is true. I dropped the mic on that. Right? We don't recognize when our body says we're done. And then not only do we not recognize when our body says we're done, we don't know what to do with it. So I say pressure will bust a pipe, right? And what we allow, we continue. And I think this also is cultural, is because we are used to putting stuff in our backpack. We don't find a way to release it, we put it in our backpack. Let something else happen, put it in our backpack. And we just struggle through and not understanding that your body is saying, I'm going to bust. And then it could be a whistle that has nothing to do with the situation, and then you go off. Right. And so then the other thing that is noticed, a lady shared very clear after she ended her caregiving journey because her loved one passed. She lost herself because all she knew was, I'm caregiving for mama. I got to make sure mama look good. I got to sure mama eats. I got to sure my mama gets the rest. And she never took care of herself in the interim, getting her hair done, meeting with friends and family, having those releases. And after her mom died, she said, I remember watching it. It was my first understanding of our caregivers. She said, I committed myself to a place called Rogers in Milwaukee. It's a mental health complex. And she committed herself because she was having a breakdown. Because at that point, she says, I don't know who I am. And I was so afraid that this was going to happen to my family. I ran back and started sharing it. And you know what they said? Ain't no wrong with me, little brother. I'm fine. And I can see all the pieces happening. Right. And that is not just my family. That's everybody on this call family too. Somebody in there providing care, or you are providing care. And you haven't talked to your doctor about it. You haven't gone through a therapist. You haven't gone and got a massage. You ain't went out with your girlfriends or with your guys. And what you've done is you continue to put the stress inside of you, that cortisol, all of that is feeding into your body, and it's got to come out some way. It's going to get out. And a lot of times it's going to go in your organs. It's going to start dealing with your sleep. And then now you are in a position where you can't care for yourself nor the person that you say you love.
Absolutely. Thank you so much. We can continue this conversation, but it's time to close out. I want to thank Dr. Bashir and Dr. Rochester for joining us today. I'm going to go back to the presentation because I just want to share a couple of things that will support with some other questions that people had. Hold on a second. Got to share. Hold on. I'm getting there. All right. Hopefully you all are seeing the right screen. So first, as we close out the session, a reminder to please scan the QR code and take a few minutes to complete the post-webinar survey. Your feedback truly matters. We got a lot of questions, not only through the registration form. There was a question that asked, do you have any questions for this webinar? And about 20 people simply said brain health. And then also in the Q&A, someone asked a question centered around brain health. And so this fits right in line with our next session. So we hope you will join us next on Thursday, June 25th, with our guest speaker, Dr. Vonetta Dotson. This session is going to explore brain health from the perspective that creating sustainable habits helps us live healthier, fuller lives at every age, because you're never too young to be mindful of your brain health. And then also someone, in the Q&A also made a comment centered around, how many people are in this webinar, and imagine how many are not here. So with that, we count on you all, our CAB members and our webinar participants to share about this. Share about the webinar, take it out into your communities, share it with your families, your churches, your organizations, your sororities, fraternities, wherever you are, share it far and wide. Because you will get the next invitation. And when you do so, share it or invite them to, go to the AlzInColor website, alzincolor.com. You can follow and share about us on social media. We have English as well as Spanish language platforms because we need each all to, as we say, raise the volume and to help change the narrative around brain health and Alzheimer's disease and ensure that, no one has to face the journey alone. So again, thank you, Dr. Easter and Dr. Rochester. And for everyone, look out for follow-up email where we'll share the webinar recording. So you can also share those with other people. It'll also be on the website under the webinars and as well as additional resources. And so have a wonderful rest of the evening and week. And thank you so much for attending this webinar. And thank you, CAB members and guest speakers and AlzInColor team. Thank you.